Ourselves. I'm Nurse Rebecca. This is Nurse Haddy, and we're here to talk to you about your new diagnosis of type 2 diabetes. Stop us at any point if you have any questions. But first off, I'll just tell you about what type 2 diabetes is. So it's when the body can still produce insulin, but it's not reacting to it as effectively as it used to. So, and what insulin does is it helps move glucose from our blood into our cells. And when the body can't do that effectively, our cells are essentially starving. And that's where we have a lot of issues. And especially with the glucose remaining in the blood, it can cause problems for other systems of the body. And this is a progressive disease, but we can slow it down with different medical management, and like exercise and diet can help as well. And then risk factors of how we got to this diagnosis would include things like old age, or like if you have a family history, hypertension.
So you mean my cells are starving? Does that mean that's why my stomach is starving too?
Exactly. Like your body is telling itself that it's starving. So it's telling you to eat more food so that it can get more sugar, so that it can move it into your cells. But because of the insulin resistance, it's just not doing it as effectively. So that's why you're feeling more hungry. Hattie's going to talk to you about some of the medical management to help you with your diabetes, and that'll help get the glucose into your cells.
Guess what?
Tell us what is your daily eating habits are. Like, what do you usually eat?
Now?
Yeah.
Oh my God. I eat everything in the house. Everything I can reach, I eat.
Do you have sweet tooth? You eat like sugary food, drinks?
I'll have my ice cream in the morning. I'll anything that is in front of me. Anything that will soothe my hunger. Because it's been hard. I've been starving so bad.
Yeah, it's not easy when you like ice cream and we're telling you you cannot have it. But do you we can have that in unmoderate, or like, have some substitute. There's some ice cream that are like sugar free. Have you tried them?
Those are not fun.
I
But do you
know.
have anything that will ease my hunger?
We do have like if you can incorporate in your diet eating more protein, like food rich in meat, chicken, just to fulfill yourself first, and then have the carbs and a little bit of healthy fat like avocado, and avoid like sugary food, because that would elevate your blood sugar in your blood.
I see.
How would this your exercise daily routine look like? Do you walk? Do you exercise? Anything to get you going? Do you have a job? Do you go to work?
Yeah, I work at night, and most of the time I'm sitting.
All right.
Yeah, I like sitting. I like easy jobs so I can sit down.
What do you think you can do to exercise a little bit? What do you think that you can tolerate?
I mean, why exercise will help me?
Exercise will help because the more you sit, it will help you burn more calories, instead of like you're eating more and you're less active. So that will just increase your blood glucose, and overall health also is good for you to build muscles. And muscles, it's better to have muscles than fat, which will.
I can walk around maybe 5 minutes. Would that be enough?
That's a start. That's a start. And then you can do that like a week and maybe add another 10 minutes later on. We'll try to have, do you have like a machine that helps you check your blood sugar?
Oh, yeah, I have one under my bed.
All right, that's perfect. Now, what we'll suggest is for you to check your blood glucose every morning. And if you can record it.
I don't know how to do that.
Will you be able to go to any healthcare center that is close by to be educated on it? or come to our center and we will be able to teach you on how to do it.
Okay.
Is that something you can do?
Yes.
Okay. So what we want you to do is check your blood glucose every morning before you eat and then write it down. We're gonna set up an appointment in 3 months, and when you're coming, if you can bring those, that will help us see how you're managing your diabetes. And we already talked about eating healthy and exercising as much as you can or you can tolerate. There are also medications that you can, the doctor will prescribe to you. All right. So we can talk about those medications and see like medication that will help you produce insulin that you can take before your meal. And this medication, if you miss the dose, if you don't eat, don't take it. Does that make sense? Because this medication increase your insulin level. Now,
Yeah,
if you eat it, you will have to eat.
Yeah, I'll eat.
You will eat.
Yes.
Right, that's awesome. And there's also insulin that you can inject. Do you know how to do those injections?
Yeah, I think one of the nurse showed me once.
Can you tell me or demonstrate on how you will take them prior to before eating?
I mean, I kind of remember. Well, is it somewhere in, is it in my stomach or in my thigh?
Yeah, you can do it on your thigh, on your stomach, or at the back of your arm.
Like there?
There you go, right there.
Okay, I remember that.
Okay. Is there any question you have for what I just said before we continue?
So you mean if I take my medication and exercise and eat more chicken than my ice cream, so you mean my diabetes will go away?
It won't go away. It will help you manage and reduce the blood sugar that are in your blood. Rebecca, do you have any other question or suggestion?
I would just say with those medications, you just want to watch out for what we call hypoglycemia. And what that means is when your blood sugar gets too low. So while we're trying to lower your blood sugar, we also don't want it to get too low. So we're going to keep it in a happy place. But if you ever notice that it gets too low, and what that means is like you're feeling anxious, you're sweaty, you're not feeling like your stomach's upset, and you're not feeling as energetic, you're tired, then you'll want to check your blood sugar. And then if it's lower than the amount that we suggest, then you need to check it again. And then you'll drink juice or some type of carbohydrate to bring that blood sugar back up.
So how low will make me sick? Or would I need to do all the stuff you just talked about?
So to check your glucose level, we want it to be less than 100, right? But then if it is like under the 50s, that's like critical. That's where you need to take those carbohydrates. If you have 15 grams to eat.
So if you happen to not be in a low state, it's easier to lower it than it is if you get to a point where you've passed out.
Because sometimes you might feel like nausea, you're sick and you don't want to eat. Always continue to take your insulin if you are prescribed an insulin to be taken daily. Consume, like we said, enough carbs and a lot of fluid, because it will help also, like, flush your kidney. We don't want you to have kidney
disease, because that can happen with diabetes if it's not controlled. So definitely stay hydrated and keep your blood glucose in a safe range.
I think I got all the information that I will need.
And do you know when is your next appointment to come check your blood glucose?
Yeah, I think it's I'm supposed to go in 3 weeks.
Okay. All right.
Well, thank you so much.
Thank you, guys. It was nice.
You're welcome.
You guys were really helpful.